Hello, folks. Welcome to my channel, Rico's Paradigm. Today, I want to talk about the things to expect when you decide to have kids in the Philippines. The role of extended family, navigating medical procedures, and meeting educational requirements are just a few of the cultural, social, and practical factors that come with raising children in the Philippines. A crucial step in this process is vaccination, which has a big impact on the child's health and service accessibility. Let's explore what to expect from raising a child in the Philippines, specifically with regard to healthcare and the possible repercussions of not following vaccination schedules. Families are frequently the cornerstone of society in the Philippines. An extended family structure is common in Filipino households, with grandparents, aunts, uncles, and even close friends helping with childcare. This network of support can be extremely beneficial, particularly for new parents. Family members frequently take an active role in raising children by providing both emotional and practical support. Increased family expectations and influences on decisions about raising children, including those pertaining to health, such as vaccinations, may also result from this. Although the Philippines' healthcare system consists of both public and private sectors, there can be significant differences in the quality of care and access to services. There are many hospitals, clinics, and healthcare providers, including specialized pediatric services in urban areas, particularly Metro Manila. However, families may need to travel to larger towns or cities for advanced medical care because access to healthcare may be limited in rural areas. Preventive healthcare, such as routine examinations and immunization, is essential for kids. Particularly for infants and young children, vaccinations are usually provided at no cost or with government subsidies and are frequently given at neighborhood health centers or hospitals. In the Philippines, vaccinations are a crucial component of pediatric healthcare. Free vaccinations against polio, hepatitis, measles, and other illnesses are available through the Department of Health's National Immunization Program. The program seeks to prevent outbreaks and safeguard public health in accordance with World Health Organization guidelines. In the Philippines, parents are usually informed of vaccination schedules through local barangay health centers and during early health examinations. Parents should be prepared to provide their child's vaccination records in order to enroll them in school or obtain certain services. These records lower the chance of disease outbreaks in communities and schools by providing documentation of immunization. Local health centers offer follow up assistance and reminders for the majority of vaccines. Previously under control, vaccine preventable diseases like polio and measles have resurfaced in the Philippines in recent years. As a result, vaccination regulations are now strictly enforced by the government and medical facilities. Parents may encounter the following difficulties if they decide to not vaccinate their children. Certain clinics and hospitals, especially private ones, may refuse to admit or treat children who are not vaccinated for specific illnesses. The main goal of this policy is to shield susceptible patients from avoidable illness exposure, particularly in settings where there is a high risk of transmission. For example, if there is a chance that an unvaccinated child could spread a preventable disease, the hospital may refuse them a non emergency service. Before allowing children to enroll, both public and private schools may require proof of immunization. To protect the public, schools are encouraged to request vaccination records from the Department of Education and local government entities. Unless they choose homeschooling or other arrangements, parents may find it difficult to enroll their child if they do not have the necessary vaccinations. Foregoing vaccination can have social repercussions. Even though not everyone will question a patient's decision, unvaccinated children may be seen as possible health hazards by some community members, which could result in covert or overt social exclusion. Furthermore, there has been a problem in the Philippines with false information regarding the side effects of vaccines, which has caused some families to be reluctant while also putting pressure on society to follow vaccination guidelines. There are currently no national laws in the Philippines requiring all children to be vaccinated, but this could change. There have been several proposals and bills to make vaccinations more mandatory. For instance, there have been debates about requiring vaccinations for school enrollment or providing more explicit penalties for parents who refuse to vaccinate their children. But the topic is also the subject of an ethical discussion. Because of their personal or religious convictions, some parents would rather make their own medical decisions for their kids. As a result, even though the government encourages vaccination, it has not yet imposed a rigorous law with legal ramifications. This implies that parents still have the option, but if they decide not to follow vaccination recommendations, they may encounter restrictions or challenges. Although they are less prevalent, alternative or holistic healthcare practices are available in the Philippines for parents who are worried about vaccines. Some families seek the help of integrative health professionals or practitioners of natural medicine who may provide on how to increase immunity through lifestyle changes, herbal remedies, or dietary changes. It's crucial to remember that these substitutes do not take the place of vaccinations in providing protection against particular illnesses. Parents should budget for additional medical costs, even though the Department of Health offers free vaccinations for specific age groups and illnesses. Specialist care can be expensive, and private clinics and hospitals may charge for immunizations not covered by government programs. For instance, vaccinations that are not covered by the regular immunization schedule, such as the human papillomavirus vaccine, may require payment out of pocket. Some pediatric services and immunizations are covered by PhilHealth, the government health insurance program, but families frequently require additional insurance for more comprehensive coverage. Budgeting for future medical expenses is advised, particularly if you choose not to use public health services. The Filipino culture places a high value on family and community welfare, so many Filipinos view vaccination as a civic responsibility to protect others. This sense of bayanihan, or community unity, often motivates parents to vaccinate their children as they see it as an act that benefits everyone in the community. Some parents may also experience pressure from relatives or neighbors to adhere to vaccination schedules for the sake of family and public health. However, vaccine hesitancy can occasionally also be attributed to cultural beliefs. The public has become distrustful of vaccines in recent years due to certain controversies and false information about their safety, especially with regard to more recent vaccines. Despite efforts to restore public trust, some families remain dubious due to this history, particularly those who have little access to trustworthy health information. Parents in the Philippines should anticipate that healthcare regulations and immunization requirements will continue to change in the future, potentially becoming more stringent in response to disease outbreaks and health emergencies. Future laws may require vaccination for hospital stays and school enrollment, with fewer exceptions permitted. In order to expedite the verification process and make it simpler to track vaccinations but more difficult to evade regulations, more hospitals and schools may also adopt digital records for vaccinations. In an effort to debunk myths and promote vaccination awareness campaigns and educational initiatives are probably going to grow. By staying informed through reputable sources like the Department of Health, speaking with medical professionals, and participating in community discussions, parents can get ready for these changes. Family customs, cultural values, and regional healthcare regulations all have a significant influence on the special pleasures and difficulties of raising children in the Philippines. Many people consider vaccinations to be a public health measure and a crucial component of child healthcare. Given the nation's effort to prevent disease outbreak, parents who opt out of vaccinations may encounter limitations on their access to healthcare, education, and social inclusion. Parents ultimately made the decision to vaccinate their children, but it's important to think about the long term effects on the child and the community at large. Parents can ensure the best results for their children by carefully navigating these obstacles by being aware of the resources and potential obstacles. All right, folks, that is all for today's show. Thank you all for watching. Until next time, have a good day.